now. Okay. Says that we're here. Anyway, guys, so as I was saying, one of the issues that I was having is that I actually did a live stream, provided a lot of information, and then for over an hour I was fighting on with the system to get it to actually publish it because it kept showing it as scheduled and kept pushing it back 5 minutes at a time every time, and I could not get it published. So now that I'm actually redoing it, it's actually overwriting the file, and I didn't have a local file that was saved, and so I'm gonna have to just redo the whole thing. But again, welcome, welcome. This is Vitaly, and again, I apologize for those who were waiting patiently. I saw there were several people waiting in a queue for it to go on, and I was trying to type in the message system in the chat that hey, this just wasn't happening. So guys, let me just minimize this here so that I can kind of focus. So Vitaly, I made another live stream earlier today. This is again regarding the coronavirus and COVID-19. As you know, the World Health Organization has declared it to be a pandemic. Finally, there was a lot of discrepancy in terms of what's considered a pandemic and not, or not. And so what I did is I made a video, and this is a video that is actually published, currently available as of a few days ago on our business channel, talking about the coronavirus, COVID-19, and the supply chain or the trucking industry. So what I wanted to do is go into slightly bit more detail, as I have a little bit more free reign here in making these videos here going live. Again, as I mentioned in the previous videos on the website, and I can link you guys out there as well so you can watch that video. It's a bit more straightforward. This is an opinion piece, so I don't understand how this virus works. I have a small, understanding of the molecular biology of things, very, very limited. And so there are other channels that you can get that information from, some fantastic places that you can get some information about how that works if it is of interest. But what I'm looking at is primarily the economic impact, supply chain, and the trucking industry. And I made some notes. These are the notes from the previous video that I had actually made, so I thought I'd go into a little bit more detail, and may have to actually make some settings here because I think that it might be a little bit quiet on the video end, so may or may not be able to make those changes here. May have to just kind of mess here. This is all a work in progress at the moment, being that this live streaming stuff, last time I did it was a very long time ago, going back about 4 years. So let me see if I can actually get the levels higher, but it's already high. They're already at the highest possible levels. So let's see. Okay, maybe this will do it. Maybe not. We'll have to see. Nope, I don't believe that will do it. Anyway, guys, apologize for that. I should have had this set up. Nope, we don't want the voice coming out up there. Listen, turn that off. Okay, so again, I apologize for this. I really wanted this to be of a higher quality video. Nevertheless, getting back on point. So guys, what I was talking about is the supply chain. I'm in the trucking industry. I own a trucking company with our own equipment, trucks, trailers. Also own a truck dispatch service where we dispatch carriers, which are basically companies that own, their own equipment, have their own motor carrier authority, as they call it, or an MC authority, and then also lease on owner-operators, where we actually have a company that is only running owner-operators, people who don't want to run their own trucking company, but want to still work, who have their own equipment, so they bring it on. They work under our own authority, so they're not company drivers like if you were like a FedEx or somebody like that, but they're not, contracting under contractors or company drivers or W-9 drivers. They are what's called an owner operator, so they're leased on. In either case, that's more detailed than you need to know, but the bottom line is that the supplies are running out, and this is having a major effect on the way that the United States, basically our supply chain is functioning. Everything is set up under what's called a JIT system, just in time. So in a nutshell, what that means is if Walmart generally speaking, knows that it's going to sell this many pallets of product between order shipments, and they're not going to order more than what's generally analytics is saying that they're going to order. And that's great and wonderful and keeps costs down. But the problem is when something like this happens, where there's a virus outbreak and borders get closed down, and we're reliant on a global economy of other countries like China, India, and others, then what ends up happening is that we simply don't have the products that we're used to having. So at this point, basic supplies are running out. You've seen the panic buying that's been going on throughout the country. I think it's going to get worse. Water, toilet paper, rice flour, masks, filters, hand sanitizers, rubbing alcohol, things like that. All of this stuff is running out, and because, like I mentioned, panic buying, there's preparations. There are lots of preppers out there, and there's also hoarding. And so this is going to actually escalate quite a bit more now that the World Health Organization has finally agreed on terming this as a pandemic. Now, the trucking industry will be strongly affected, and this will be a negative effect. I do believe a lot of companies will close doors this year and into next year. We are expected to lose 50%, upwards of 50% of the country's wealth. So whatever, your dollar in your pocket will be worth 50 cents, and that's the most simplest way of looking at it. There's a common quote or a saying in the trucking industry, and it goes like this: if you bought it, a truck brought it. And that's very, very true. Everything that you see on the shelves in today's society, on store shelves, yeah, a truck brought it. Okay, it didn't just appear there. So for those of you who are not truck drivers, I do recommend be mindful of truckers. Give them a little bit of respect. They deserve it. It's a very difficult job that they're doing every single day. I mean, you guys don't even, a lot of those guys don't even know how difficult it is. I mean, they work 14 hours a day and drive upwards of 11 hours in those days. And it's crazy. It's really crazy. So like I said, if you bought it, a truck brought it. So Costco is an example that I brought up in the other video. When I was a kid, I worked at Costco, and after a while, I left the company, but still had a lot of relationships that were built throughout the organization. And whenever I go to my local Costco, I sometimes, if managers are available, have a quick chat with them. So we talked about water because we were stocking up on some water. We went there with a couple of families, and so there was a lot of water that we were buying. And at the time, there were no limits, right? Now, recently they put in a limit of 5 cases of water per membership. Now, currently, there's a limit of only 2 cases of water per membership. Now, the manager, what he had told me, what he told us was that normally they sell half a truckload of water throughout the entire day. When we met with them a couple weeks ago, they said they were up to 2 to 3 truckloads of water by noon, and after that they were out, right? And they had to come back the next day for the following shipment, the next day's shipment. So those, now there's water in Costco because what's happening is, they're limiting, and so it allows the more people to have access to water, but they've had to limit all kinds of things, right? Like they probably set limits at this point on rice and flour and sugar and basic necessities like that. Another example is Baxter. It's a company that produces medical supplies such as syringes, saline bags, possibly the injectables and possibly even face masks. And so they have basically made an agreement that all products will be sold to state and federal pardon me, state and federal governments and medical facilities and medical organizations and whatnot. India, as a good example, India, and I did not know this, but they produce 25% of all of our genetic drugs, or at least produce and provide us the ingredients of 25% of all the genetic drugs that are provided in the United States. What happens when you start running out of medications? And that's actually happening already, because there's actually a list published, and one of the top items in a top 10 list are actually ADHD medications. So that Adderall is on that list, right? What happens when all these medications, like heart medications, diabetes medications, cholesterol medications, things like that, and ADHD and et cetera, or other types of sedatives, for example, go out of stock and are not available, right? That becomes a problem. There was recently a report of a lady who was taken off of a quarantine from one of the ships. Because of the quarantine, she had actually missed one of her cancer treatments, and she's in fourth stages of cancer, and she was concerned that now that she's getting off the ship, now she's going to be quarantined for another 14 days, and what's going to actually happen now? Is she going to miss another treatment? Really scary stuff. So that, all these things are something that we don't really necessarily think about until it actually happens. And trucking as an industry, it will slow down. By the way, please, subscribe to the channel, guys. I know that I haven't uploaded anything on this channel for some time, but I am switching gears, and I will be doing this. Now, the reason, as I mentioned in a previous video that I'd made, that is posted, that is available, the reason that I may be kind of more qualified, if you will, to do this is because for the past several months, since this whole thing started, I've been following this very closely. I've been watching everything you can find, and really trying to draw lines and have a better understanding of what this is all about. Now, the reason, a lot of people might be thinking that they're doing that, but the difference is that I work from home, and I have the freedom and the flexibility to be able to keep my eyes open and keep my ears open, and really stay informed about all the things as they happen. And so that's the reason why. So a lot of people I've actually stopped talking to about this to many people, because unfortunately they still think it's a game, they still think it's a joke, and they still think that this is not this is not actually happening. It is happening. This is reality, folks. We are here. We have arrived. Trucking will slow down. Everything is imported. Most of our products are imported. The United States practically doesn't produce anything. It's scary to say that. And the JIT system, the just-in-time system, while it works very well on a business level, it doesn't work very well at all when we have such catastrophic events such as what we're seeing at this time, right? So, and this is, one of the things I had mentioned in the previous video is that Kia and Hyundai have stopped production of cars. They cannot produce cars. They cannot repair cars. Why? Well, a lot of the parts are produced in China, and they're unable to get them, right? So another Jaguar and Range Rover, I apologize, Range Rover, they had mentioned they had a week worth of supply, so they will not be able to produce cars or possibly repair cars any longer. One of the largest car manufacturers in the UK. And plus, you got to consider that when it comes to truckers, they're human beings. Truckers, they get sick. Some of them will refuse to work. Some of them will be unable to work. What if there are mandatory quarantines? What if there are road closures? What if shippers, receivers, what if they shut down? What if the employees don't come into work because of illness or because of refusal to work, or mandatory quarantines, or possible martial law, if that goes into like medical martial law, which I'm not sure if that will go into effect, considering that the United States, we're a little bit different. We're not a communist country, which is a lot different. But my point is that we have our ways of life, right? We have certain liberties that we enjoy, and certain rights that we enjoy based on the Constitution. And a lot of countries, most countries don't have that. A lot of countries have a constitution, but it's not upheld. So what do you do in a country that has more guns than people? What can we expect when all hell breaks loose? Because it is coming, folks. The last statistics are showing that only 5,000 cases or 5,000 people have been tested. And mind you, this is in a country of 330 million people, right? So you got to consider in Italy, they have a population of 65 million people. United States is 330, and look what's going on over there. I think our statistics are closer to, apples for apples. I think it looks a lot closer to what Italian statistics look like, except they've been testing and we haven't. And that's a part of it is, a big part of it is because of the CDC and how they handled it. They basically, once again, again handle it as a business and they didn't want to lose revenue. And that's why they didn't allow other third-party manufacturers to produce these tests. Then what happened is that they produced the test, the CDC did, but they decided that why only test for one virus when we can test for three. When they did that, they created a problem. Those tests were bunk and they didn't work well. That set them back 2 to 3 weeks. Then they opened up the market to third-party manufacturers, and now we're expecting to receive new shipments of these tests, right? So shippers, receivers, truck stops, lumpers, these are the guys who load and unload trucks, with pallet jacks and other types of equipment. And these people are all involved in the supply chain and in the industry. Without all of these people, trucks cannot go anywhere. They cannot get fueled up. They have nowhere to park. They have nothing to eat. They have nowhere to shower. What if shippers and receivers, their employees don't come into work? What if they, like I said, refuse to come into work? What if product is tainted? What if one person gets sick and then the whole place has to be tested and quarantined, right? They have to clean out everything, all the product. What if the shipments, the pallets of product get tainted with these types of things, with the virus? There's a lot to think about there, a lot to think about. And so that's why I think trucking will slow down. And I hate to say it, but companies will see a lot of closures. The small companies, especially the new ones, I really feel bad for the new trucking companies. They go out, they open their MC authority. As it is, 99% of brokers, or 9 out of 10 brokers, will not work with a brand new MC authority under 90 days. Which, can you imagine? You just open up a truck, you got your payments, you have your family to feed, you got your truck and trailer payments, your insurance is through the roof as a new MC authority. I mean, everything is difficult, everything is brand new to you, and suddenly already brokers don't work with you, and then all of a sudden, bam, this thing hits you, and prices drop, because the math is simple. Lots of trucks, low amount of freight because of no imports, means low rates, right? And to operate a trucking company costs quite a bit of money. The operating costs are quite high. The fixed costs alone are quite high. And oftentimes what I'm seeing now is that truckers simply are not making enough money to even cover their operating costs. So it's a really tough situation. And truckers get sick. You know what I mean? That may also happen. We may find that guys get pulled in. They go to truck stops. Maybe people get quarantined. They have to live on the road and inside the cabs and the sleeper berths, and it's going to be really, really tough. And companies will close from quarantines, medical martial law, and I'm hoping that there will be allowances made for truckers to continue keeping this country up and running. Problem is that a good idea or not? Right? On the other hand, people need to eat, people need to drink, people need to be able to have what they need in order to survive on a day-to-day basis. I mean, even if they don't allow us to go to stores, or there'll be a limited availability for that, at least maybe there will be some sort of delivery services available, government mandated delivery services, or by the National Guard or something like that, but something that will be available to make sure that people have what's needed in order to survive in their day-to-day lives, right? So again, low rates will take out a lot of trucking companies. I hate to say it, but that is the reality that we work with today. And I won't go into the rest of this, because the rest of it was talking about how people need to join our service. I operate a trucking company. I also help operate another trucking company where we only work with leased on-owner operators. I also own a dispatch service, and we also, my business partner has his own trucking company, which is separate, and then they have company drivers there. So there are 4 different organizations operating this on a very large scale. And I'm not going to go into on this channel at least, about joining our service and getting in and starting with us. The truth is, our phones have been blowing up, and there's a lot more interest. People are emailing me all the time. They're calling in. They're trying to get started, because I think deep inside people realize and understand that, hey, no matter how big we are, we can't handle the entire trucking industry. And so that's why they're calling in. But that's really enough information there. The bottom line, the way I see it, is that the government has completely dropped the ball on this, right? They've completely dropped the ball on this. The testing has been completely, berserk. That was just a big, huge, stupid mistake that was done. The fact that that people are going out there. I mean, have you heard about the stories about the guys who were told that they tested positive to go home and quarantine themselves, and then they go hit the bars, clubs, and in different places like this. There was a one guy in Japan who went out and he found out. He went to a bar, then went to another bar, drank a bunch, got drunk, and then mentioned that he had coronavirus, and he told his family that he was going to go out and infect others. There was also some young people here in America, in the United States, who did something very, very similarly, and they were proud to say that, hey, the world needs to end. Too many stupid people out there. We're going to go and infect more people. That's just the wrong kind of thinking. You know what I mean? Like, that's just not the way to go. But the bottom line is that you need to be prepared. A lot of people are simply not prepared. In the previous video, I talked about a friend of mine who I was discussing this with, and I had mentioned to her that, hey, listen, you really need to consider. Let me see if I can make this a little different. Oh, that's not right. That you really need to consider doing these things and being being on par with where the world is going. And she just didn't want to hear it. She didn't want to even understand what I was saying. She would rather consider that I'm just talking out of my rear end. But the truth is, now she's thinking very, very differently, and now she's actually considering what I've told her, and actually doing something about it. The problem is, it's a little too late almost. You know what I mean? And it only took several weeks of talking, several weeks of bringing up this information to her, and several weeks until some other people that she respects and listens to started showing concern. And at that point, she decided that she needed to make some changes, and that's when we really got into a bit more of a conversation as far as what she needs to do. So, hopefully people smarten up, but I honestly think it's a little too late. I honestly think that there are so many ill people right now that are infected, that are in the walking around all over the place. Like yesterday, I went out, was really leery, didn't want to do it, and met up with some friends I hadn't seen in a coffee shop, and I didn't feel right. We went out to a restaurant with some friends again. The same thing. I was like, hey, maybe we shouldn't be doing this, and that's partly my own fault. Not partly, that's fully my own fault, at least for my own actions, because I knew that it was wrong and I shouldn't have done it, but we still went out and did it, and we still meet with people, for business, and I have family members who work in the hospital system and the medical system, and in a pulmonary, deal with pulmonary cases and things like that, in the X-ray departments, and so that's tough, because whenever something like this happens, they send them in for an X-ray, and I don't want my loved ones being unnecessarily exposed to something. Plus, the N95 masks at the hospitals have all been locked away, so what are you going to do? So there's a lot of some weird stuff that's going on, and I just urge you guys to please like and subscribe to the channel. It doesn't take much effort, but I'm telling you, I'm going to be providing you a lot of information. This is something that I've been wanting to do for a long time, but with work I just couldn't get myself to do it, and I wasn't sure if this was the right time to do this, but today is the day, because the World Health Organization has said this is a pandemic. Officially, this is a pandemic, and so because of that, I said, you know what, I'm just going to pull the trigger. I'm just going to go ahead and do this. I'm just going to go ahead and do this. So in any case, I hope that you guys will be able to like this video. Send me your comments, send me your questions, whatever you might have. If I don't know the answer to it, I'll point you in a direction of someone who can answer those questions. And subscribe to this channel and like it, because YouTube has been playing these down. They're removing certain words off of, if it says coronavirus or COVID-19 on a thumbnail, they actually filter that out. That's some cool technology, but unfortunately it's being used in a wrong possible way. And also take a look at my channels, featured channels area, where I basically added a whole bunch of different channels that provide some fantastic information that you guys can really, really benefit from. And I would definitely, I have nothing to gain from this. I want you guys to know up front that I'm not monetizing this channel. I used to monetize back in the day, but I was like years ago. I'm not monetizing this channel. I don't have any affiliate links, no Amazon affiliate links, nothing like that. I'm not interested in getting money from you guys. I'm not putting up donation links, nothing like that. I just want to provide you guys the information, and as the days go on, these videos will become a lot of better and of higher quality. So don't, they're going to be much better than what you're seeing now, okay? So I'm still working out a few kinks here with the technology aspect of things, and I've had some issues. I've recorded multiple videos, and they were kind of stuck in a strange spot where they just weren't being published. I could watch them, so they were recorded, but I just could not do it, and I won't get into it. It just created a problem. They were good videos, and unfortunately I couldn't publish them. But in any case, guys, be safe, stay out, use your head. When they tell you that the masks don't work, that's BS. Yeah, you can't get any more masks. Everything's basically sold out, and people are price gouging online and in local, classifieds and things like that. But the truth is, masks do work, N95s do work, 98s work, 100s work, Rs work, Ps work. So all these things, you can get respirators, they work, and you just need to, at this point, listen to common sense. Obviously, covering your face with something is better than nothing. So even if you put a t-shirt over your face, that's still going to be better than just walking around without anything. Something new that I also learned today, that it turned out that latest research has shown that when somebody sneezes or coughs or something like that, we'll call it a propellant or whatever, goes out, the virus comes out, it can stay airborne for 30 minutes. So imagine now, you go to a coffee shop, you go to a public place, and somebody did that 20, 30 minutes ago, and you just simply walk through it. Well, there you go. You're now potentially infected. It may be on your body, on your clothes, on your face. So it's very important to keep very high personal hygiene. Anyway, won't keep this going. I'll talk to you guys very soon. Appreciate all the time, and look forward to working with you guys and getting your questions, comments,